At the ASH meeting, we showed information in the form of a poster that did an analysis of secondary genetic changes that are observed in myeloma. And in particular, we were very interested in understanding the effects of chromosome 1. Extra copies of chromosome 1 have been identified as markers of more aggressive disease. But the question is it all the same? And our hypothesis that it's not. A lot of patients can have 3 copies instead of 2, so what's called a gain. Now, when someone has 4 more copies, that is called an amplification. Many studies have tried to lump them together and then call that high risk, but that is very problematic because in some series, up to 40 or even 50% of patients have that. So you cannot suddenly call 50% of patients as having high-risk disease. So we wanted to differentiate the effect of 3 copies versus 4 copies as a secondary genetic change. And for that reason, we use a Mayo Clinic data set for FISH that is done on patients with multiple myeloma. So we believe we had enough statistical power to make a distinction between 3 and 4 copies. And what we showed was when you look at the survival curves, it's clear that if you have 3 copies as opposed to a normal 2, there's some decrease in your survival. But the big effect comes from 4 or more copies. So I think we need to move forward with the notion that all chromosome 1 abnormalities are the same towards saying it's really amplification what makes the big difference. 3 copies is important, but it has about the same weight that we had in the past with, say, like chromosome 13 abnormalities. When you really want to look at high risk, you have to look at 4 copies. And to conclude, I'm going to say that we compared 4 copies with the high-risk translocations, and they all seem to have a similar outcome.